Hello all. Thank you so much for having me. I started my creative journey 5 years ago during the COVID-19 pandemic, when I also started my psychology studies. At first, I just wanted to share my passion, so I posted book recommendations, psychology theories I learned at school, and also some many mental health tips I learned as a lecturer of workshops at high schools. As time went on, my content became more personal. I also shared my studies and the obstacles I was facing while becoming a psychologist, and also the fact that I sometimes felt lost and needed help. If you know my content right now, you also know that I share many mental health tips. But I also share that it's really okay to use them, because I use them all the time as a student, as a psychologist, but most importantly, as a human. People started messaging me things like, because of your posts, I realized I needed to take care of my mental health. Or because of you, I finally reached out for professional help. Some even shared that they had started conversations with loved ones they were worried about. And that made me realize that this is not just about me sharing my passion. This is not about numbers on social media like likes and comments. This is about people finding courage and support in a space they use every day. For context, during the COVID-19 pandemic, we were hearing numbers and statistics everywhere, and also numbers about mental health. Between ages 2017 and 2020, the number of people struggling with mental disorder increased by more than 12%, and over 30% of adults will experience a mental health problem in their lifetime. At the same time, we face severe shortage of professionals, long waiting lists, and the same stigma that still prevents many from reaching out for help. So I began to ask myself, can social media really make a difference? Can it at least fill a little part of the gap we all see in our mental health care system? And what role should professionals play in a digital space? And this led me to my research. I wanted to understand what it actually feels like to engage with mental health content on social media, beyond numbers, beyond algorithms. Because we know the numbers. We know that people are interested in mental health content on social media. But what I wanted to capture was the experience. So I invited groups of young adults to talk about mental health content on social media. We sat in focus groups, we shared, and we listened. And to be clear, we are not talking about some big research, because we are in the beginning of talking about this topic. But what I found was interesting. The essence of experience of people with mental health content on social media could be summed up in one simple sentence. I realized I was not alone. And this is not about replacing therapy, but this is about connection, courage, and support, and also hope that there is something or someone that could help me when I don't feel at my best. But it wasn't always easy. Participants also spoke about some risks of social media and mental health content on social media, like information overload, emotional overload when you're scrolling through endless posts about depression or trauma, and of course, self-diagnosing and social media addiction. So we still have questions. How could we cope with this paradox that at the same time, can social media drag us down and also be that glimmer of hope keeping us afloat on a surface? And still the question, what role should professionals play in a digital space? That was too quick. As psychologists, psychotherapists, and other professionals, we sometimes hesitate. We worry because we don't know if social media is professional enough. And what if we are just adding fuel to the fire? But what I've learned, you already know that because I showed you, what I've learned is this. Our presence matters. Because when professionals step into the digital space, we don't just share knowledge, we build bridges. Bridges between digital world and real-life help. Bridges between someone's silent struggle and the courage to say, maybe I should or I could reach out. And this is not about replacing therapy. This is about hope that there is someone that could help me when I don't feel at my best. So, here is what I would like you to take away from today. Social media or digital space is not just for entertainment, memes, and endless scrolling. It can be also a place for hope, connection, courage. Because this can be the bridge between silence and seeking support. Because maybe someone will realize that there is hope for reaching out for help, and this is where we all have a role to play. As professionals, we need to be brave enough to step into the place where people already are looking for answers, not to replace therapy or another professional help, but to guide, to educate, to humanize mental health care. As humans, and maybe also users of social media, we can be open to learn, to talk about mental health, be present and notice people around us, how they feel, because this can be, and you can be the reason someone feels less alone. This can be, and you can be the reason someone feels that help is a little closer. And if we connect and embrace our power, maybe we can change the way society thinks and talks about mental health, but also we can help people realize you are not alone. Thank you.